wondered what the difference between a neurologist and a neurosurgeon is? In this video, I'm going to try to explain it. A neurologist essentially is someone who is a physician who looks at the brain and tries to diagnose a neurological problem. A neurosurgeon is someone who does the same thing but has the ability to perform surgery on your brain. So yeah, it's really quite simple. Neurologist doesn't do surgery, neurosurgeon does. Now that's only like the surface level difference. There are a lot more, but that's the basic one. And now you may be wondering how to become a neurologist or neurosurgeon. Well, for the first two steps are really the same. A college, usually a 4-year degree, and med school. Now, it's important that in college that you really can major in anything as long as you have the essential med school requirements like Gen Chem 1, Gen Chem 2, Bio 1, Bio 2, Organic Chem 1, Organic Chem 2 with labs, and some biochem classes. Now, those are obviously just the standard med school requirements. There can also be some specific ones like language and statistics. And now this is med school, so this is essentially where a doctor gets their MD degree. It's usually 4 years long. And then residency is where it quite differs a little bit. Example for neurosurgeons, the training in residency is 7 years long, so it's a 7-year neurosurgery residency, and there are also multiple different types of subspecialties that a neurosurgeon can choose to, subspecialize in. Example being pediatric neurosurgery, in which case you need to go through a 7-year neurosurgery residency and 1 year of pediatric neurosurgery fellowship. Now, for a pediatric neurology residency, there are two different options. One option is to go to a combined or integrated pediatric neurology program, in which case you have to do 2 years of pediatrics, 1 year of adult neurology, and 2 years of pediatric neurology. So this is essentially a 5-year program. And the other pathway is to go through a traditional neurology pathway, in which case someone would do a pediatric neurology residency first, which is about 3 years long, and then apply for a pediatric neurology fellowship, which includes 2 years of pediatric neurology and 1 year of adult neurology. And obviously, these are just the standard programs. Some residency programs may do it a little differently, and may choose to subspecialize in different topics, but these are just standard level ones. And there are also multiple subspecialties other than pediatric neurology. Subscribe for more neuroscience videos!